Dr. Daniel Lee is our next speaker.
Good morning, everybody. All right. Thank you. So my name is Daniel Lee, one of the glaucoma specialists here at Wills. The purpose of this talk is to really give you a basic overview on what glaucoma is, and we'll also talk about how glaucoma affects your vision and also how it's affecting people around the world. So the title of the talk is Understanding Glaucoma and Its Impact. So first of all, what is glaucoma? Books and books have been written about this topic. People have argued for hours and days on end about what the true definition of glaucoma is. But boiled down to its simplest terms, glaucoma is damage to the optic nerve. And it's a damage that is often caused by high eye pressures. Now, I do want to emphasize the fact that I said often and not always. Because certainly there are people with very high eye pressures that never get glaucoma. And there are certainly people on the other hand of the spectrum where they have very low pressures and still have glaucomatous optic nerve damage. The optic nerve is the cable that connects the eyeball to the brain. And basically it allows our brain to understand what we're seeing through our eyes. So you can have a normal eye, you can have a normal brain, but if the cable is damaged, then you're not going to be able to see. This is a photograph of the optic nerve in the inside of our eye. That orangish, pinkish circle that you see in the middle there is the optic nerve. And you may be wondering, if the optic nerve is a cable, why does it look like a circle? Basically what you're looking at is the insertion of the optic nerve into the back part of the eyeball. And like a cable wire, when you're looking at it at its end, it can look circular. But certainly if you look behind this area, it would look like a cable. There are different parts of the optic nerve here. So this purple circle is demarcating the outside limits of the optic nerve. That whitish area in the middle is called the optic cup. And perhaps the most important part of the nerve here is a neuroretinal rim, and this is pretty much the meat of it all, where the nerve fiber layers exist. The optic cup is the part of the nerve where there are no nerve fiber layers. Everybody has an optic cup. You can think of it like a donut. So the donut hole where there is no pastry is the optic cup, and the actual donut itself is a neuroretinal rim. So worsening optic nerve damage can be seen by thinning of the neuroretinal rim. You may often hear your eye doctor talk about enlarged cupping in your eyes, but this is really a byproduct of the actual nerve tissue thinning out. The disc damage likelihood scale is something that Dr. Spaeth came up with and described, and it describes the changes in the neuroretinal rim a little bit more accurately than cup to disc ratio. So although the size of the donut hole has been going down through the years, in glaucoma, that's the size of that donut hole tends to get bigger if things are out of control. Other findings we look for on exam is we look for a notch in the optic nerve. So if you follow that contour of the cup, you see that there's a portion of that neuroretinal rim missing on the bottom. That's a sign of glaucoma damage. And sometimes we see a blood spot on the optic nerve. And at times that can be a signal for us that things are a little bit out of control, that things may be changing in the optic nerve that cause it to bleed. So to take the analogy of the donut a little bit further, a notch is like somebody took a bite out of the donut down there on the bottom. And that blood spot is somebody took a bite out of a jelly donut and some of that jelly is leaking out. Other findings we look for is asymmetry of the optic nerves. So as human beings, we tend to be pretty symmetrical on both sides. Our hands are about the same size, our ears are about the same size. Our optic nerve should also be about the same size. So if you're doing an exam of both eyes and you find that one nerve looks a little bit different from the other, you have to start to wonder whether or not glaucoma has caused that change. So how does this nerve damage affect our vision? The problem with glaucoma is that usually it starts to affect our peripheral vision first, and it usually occurs very, very slowly. And for that reason, it's nearly imperceptible until significant damage is present. And Dr. Spaeth talked about the green, yellow, and red, and you have no symptoms until you get into that red zone, which is severe stages of glaucoma. And just as an example, this is a visual field from one of my patients last week. He was a 65-year-old gentleman, very highly educated man. He was a chemist, a professor at a nearby university. He noticed his vision was getting worse over the past year, and he wanted to get his eyes checked for cataract surgery. That's when the doctor found out that he had a lot of optic nerve damage, and this is what his visual field looked like. A lot of his peripheral vision was already missing by the time he came. So how is it that people walk around with that much visual field damage and not know it? This is a picture that I got from the National Eye Institute website. The picture on the left is a normal eye, and the picture on the right is showing tunnel vision that you might see from glaucoma. So how can you walk around with tunnel vision like that and not realize you have glaucoma? It doesn't seem to make sense. One of the explanations for this is something called cortical plasticity, which is, in basic terms, it's your brain knows how to compensate for missing areas in your vision. So your brain can adapt. So this is a visual field of somebody without glaucoma, and as you can tell where the green arrows are, everyone has a little bit of a blind spot. Everyone has a natural blind spot. But how can we walk around and we don't see two dots floating in the middle of our vision all the time? It's because of cortical plasticity. Your brain is filling in that area with data so that you have uninterrupted vision. This may or may not work. This is an optical illusion here, but this demonstrates cortical plasticity. So if we all spent a few seconds looking at that yellow star up in the upper right corner, you may notice after a few seconds that the gray square on the bottom left disappears. So let me just give you a few seconds to look at that. It may or may not work. And basically what your brain is doing is it's filling in that gray spot with the surrounding colors and the surrounding patterns. And this is how your brain kind of covers up glaucoma visual field loss. This is an artist's representation of what a visual field, what your vision might look like with glaucoma. So this is a normal eye with no glaucoma. Then you have some moderate damage there on the bottom right. You're noticing that it's not black. The brain is filling it in with the similar textures and similar colors, but there are certain parts of the vision that's missing there. So let me go back to the normal, going to moderate. And then when it becomes severe, you're seeing patches of blurriness, but you can see how this thing can creep up on you. If the changes have been occurring over years and years and years, oftentimes these changes are imperceptible. It's like trying to watch your fingernails grow. Oftentimes you can't see it happen, but after a couple of weeks it's suddenly long and you need to clip your nails. Same thing with your visual field. This was actually studied in a place called Moorfields in England, and they showed 6 pictures to people with moderate to severe glaucoma, and they asked them to pick the one that most represents their vision. Now, the top middle one is the one that myself and maybe most of us would assume that don't have glaucoma it would look like. But to their surprise, and to my surprise, nobody said that they had a black tunnel. And nobody said that they had the black parts in the bottom left. Most of the people in this study said that they have just blurred areas in their vision. And even scarier, this is moderate to severe stage glaucoma. About a quarter of the people were not aware that they even had any visual field defects, even though on visual field testing, they had definite issues. This is why we call glaucoma the thief of sight. So in the early stages of glaucoma, the vision changes which are definitely there on testing are often not recognized. And for this reason, about 50% of people in this world with glaucoma don't know they have it. So let's talk about glaucoma in America. It's the second leading cause of irreversible blindness in this country. About 2% of adults over 40 years old have the diagnosis of glaucoma. And the older you get, that percentage goes up. The general risk factors for this is, again, the older you get, the more likely it is. If you have a family member who also has glaucoma, your risk goes up significantly. If you have a sibling with glaucoma, your risk for glaucoma increases by 4-fold. And if you have a mother or a grandfather with glaucoma, it's about 2-fold. African Americans are disproportionately affected by glaucoma as well. The global burden of glaucoma, it's the leading cause of irreversible blindness worldwide. So in 2013, we think there were about 65 million people in this world with glaucoma. We project in 2040 that this number is going to nearly double. It's going to be 111.8 million by 2040. So this is a rapidly growing issue. Unfortunately, we don't have a cure for this disease. So if you have optic nerve damage and you lost visual field, we don't know how to bring that vision back at this point. So the rule of thumb is if there's vision loss from glaucoma, that's permanent vision loss. The optic nerve, like the spinal cord, is part of something called the central nervous system. And this specific kind of nerve just does not regenerate when it gets damaged. So definitely this is something that needs to be prevented, and you need to get your eye exam every year, at least. The good news is that blindness can often be avoided with proper treatment. So there are a lot of good treatments out there, and all of them treat glaucoma by lowering eye pressure. So there are new medications that Dr. Dale will be talking about today. There are lasers that Dr. Spaeth had already mentioned, like the laser peripheral iridotomy, selective laser trabeculoplasty, and also there are newer surgeries that are now coming out that Dr. Marlene Moster will touch upon as well. Now, is pressure the only factor that causes glaucoma? We don't think so. We think there are a multitude of factors. The problem is over the years we've been researching these things and we were not able to identify a modifying treatment for glaucoma as of yet, but this is ongoing research at this time. So in conclusion, glaucoma is a progressive disease that if left untreated can lead to blindness. There are little to no symptoms in the early stages. So if you have not had your eyes checked in over a year and you're over 40 years old, I would strongly consider getting screened for glaucoma today. Actually, as we speak right now, there is a glaucoma screening going on upstairs, and this screening will continue until 1 p.m. So if you have not had your eyes checked by an ophthalmologist or an optometrist the past year, and you have some of the risk factors for glaucoma, certainly consider going upstairs and getting this free eye exam. Thank you.